Hello, everyone, and welcome to our Back to School Tips for Children with Special Health Needs and Disabilities workshop with Karen Price, VFN's co-director of Family Support Education, and Kaitlyn Kodzis, state school nurse with the state of Vermont. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. I'm excited to introduce you to Karen Price and Kaitlyn Kodzis. Thank you so much for joining us today. Karen, I'm going to turn things over to you.
Thanks, Jamie. So again, I'm Karen Price and I work at the Vermont Family Network. Vermont Family Network is part of a national network of parent centers. There is at least one parent center in every state. Parent centers help families who have children with disabilities or special health needs. At VFN, we help families with educational, health, and other disability-related needs through our family support programs, including helpline, workshops, webinars, and various other programs. We have helped thousands of parents over 30 years through the special education process, and I have developed a series of short slides today to deliver some key messages about going back to school. Next. So parent centers like VFN are funded under IDEA, the Individuals with Disabilities Education Act. Why? Because one of IDEA's foundational principles is the right of parents to participate in educational decision-making regarding their child with a disability. The law is very specific about what school systems must do to ensure that parents have the opportunity to participate in the IEP process. Parents are equal members at the IEP table. Next. So get a good start to the next school year. Schedule an IEP meeting before the year begins. Prepare by reviewing your child's school paperwork and ask the school for copies if you are missing anything. Gather any needed documentation by non-school professionals like therapists or doctors who have knowledge of your child. Consider having someone else, a friend, a family member, or a professional, to attend the meeting with you for support. VFN does have some limited meeting support. Think through what you want to accomplish at the IEP meeting and put everything in writing. Next. During the IEP meeting, be an active participant and listener. Ask questions if you need more clarity. You could consider taping the IEP meeting to maximize your ability to participate and process the information. We recommend that you inform the team beforehand if you choose to do so. Next. Schools should be assessing your child to measure the degree of regression that might have occurred and to modify the IEP accordingly and within process. Compensatory or COVID-19 recovery services might be necessary to help your child make up for his or her loss of skills. VFN has sample letters for parents to request compensatory services. Think about what transition services could help to start your child's year off. Perhaps a visit to the classroom or a one-to-one meeting with a classroom teacher before school starts. Ask for details of the classroom routine. Tell the teachers what your child might need. Perhaps a daily personalized greeting, visual reminders of classroom expectations or peer support. Next. I'd like to remind parents that parent training and counseling are amongst the many possible related services that can be written into a child's IEP. What you see on the screen here are just some of the few of the related services that could be in a child's IEP. Next. So VFN and the Disability Law Project had developed a webinar in August of 2020 on educational options under the IEP, which is available on our website. During this still turbulent time, parents need to be aware that homeschooling means your child is no longer enrolled in public school and loses their entitlement to an IEP. An IEP educational placement decision can include the home. The IEP is still in effect in the remote or hybrid instructional model. There are also special considerations for homebound and hospitalized students. Next. Act 264, or Coordinated Services Plan, could be an option for some students on IEPs. This is not part of the special education process, but is another process available for those students who are eligible and allow multiple providers, of which the school is one, to collaborate around wrap-around services for a child and family. Next. Here are a few special education resources. This includes the Vermont Family Hour website, Rights Law, Cadre of the Center for Appropriate Dispute Resolution and Education, the Center for Parent Information and Resources, and OSEP. And now I will turn the presentation over to Kaitlyn Kodzis, who will be covering school nurse services as part of the related services in an IEP.
Thank you, Karen. Again, my name is Kaitlyn Kodzis. I'm the State School Nurse Consultant at the Vermont Department of Health. So who is the school nurse? The school nurse is the link between the healthcare and educational communities. They are an essential member of the multidisciplinary educational team that assists in identifying children who may need special education or health-related services. And what is their role in the Individualized Educational Program or IEP team? In the school setting, the school nurse is the licensed healthcare expert who conducts a comprehensive health evaluation and interprets the child's health status to aid in the development of the IEP. The school nurse's involvement in this process ensures that the IEP provides for the required health needs of the child and enables the child to participate in their educational program. The school nurse also assists parents and guardians in identifying and accessing community resources and assists in the removal of health-related barriers to learning and translates healthcare provider orders for the school setting. For school staff, the nurse can explain the child's health impairment and provide in-service training about the individual health needs of the child to ensure that they can safely access all components of their educational program. They can plan for potential health issues that may occur in schools, allowing school staff to know response and prevention activities. The school nurse evaluates the effectiveness of the health-related components of the IEP with the child, parents or guardian, and other team members, makes revisions to the plan as needed, and advocates for appropriate recommendations. The school nurse develops goals and objectives for the child in school and creates nursing protocols to meet child-specific health needs during a school day. They monitor the child's progress and can initiate an IEP reassessment when indicated. The development of individualized health plans, or IHPs, and emergency action plans, or EAPs, are unique to the school nurse and are based on their nursing assessments. Under the related services in the Individuals with Disabilities Education Act, school nurse services are defined as services provided by a qualified school nurse. School health services are services that may be provided by a qualified school nurse or another qualified person. These services may be delegated to another by the school nurse. The school nurse can train and supervise staff members in the provision of specialized healthcare services within the school setting. If these services are required for your child, the school nurse can help in the creation of goals that require school nurse or school health services, such as self-care or health management skills. Next slide, please. The IHP, or Individualized Health Plan, is a plan of care written by the school nurse for children with or at risk for physical or mental health needs and in need of more complex school nursing services. It ensures that all necessary information, needs, and plans are considered to maximize the child's participation and performance in school. It may also encompass the child's knowledge about their condition, self-care abilities, and modifications needed to enhance learning and prevent emergencies. It is created in collaboration with the child, the family, and healthcare providers. It is based on the nursing process, utilizes nursing languages, documents standards of school nursing practice, and is driven by outcomes. The school nurse is responsible to annually evaluate the IHP and update it as appropriate to reflect changes in healthcare needs and address nursing interventions and health outcomes of the child. The IHP fosters communication amongst nursing staff to promote continuity of care for a substitute school nurse or as the child progresses through the school system. The ultimate goal of the IHP is to guide care coordination for the child. The IHP facilitates evidence-based management of a health condition, outlines the relevant knowledge and actions needed by school personnel to support the child's access to a free and appropriate education, and assists in the preparation for prompt responses to medical emergencies. It can be a basis for the creation of an emergency action plan. Next slide, please. The Emergency Action Plan, or an EAP, is a written plan and procedure that provides steps for action should there be a health crisis, such as a seizure, asthma attack, or an allergic reaction in school. The EAP informs school staff who will do what, when it will be done, and where it will be done. It also identifies both response and prevention activities when possible. The EAP is given to school faculty and staff, including teachers, playground or cafeteria aides, principals, bus drivers, and coaches who need to know how to recognize a health crisis and intervene appropriately. An EAP should be developed in collaboration with the parent and guardian and healthcare provider. An EAP is written for a child who is more likely to have a specific medical emergency. It can be part of an IHP or used instead of an IHP. An EAP prepares the school nurse and school staff for medical emergencies. It can be used as a quick reference for school staff when determining that a child requires emergency intervention. It uses language that is clear and terminology that can be understood by faculty and staff. Next slide, please. The school nurse is also an essential member of a transition planning for a child. Transition planning refers to a coordinated set of activities that assists a child when entering school, re-entering school, between schools, and beyond secondary school. There is additional attention paid to those children with chronic or acute healthcare conditions. Planning requires identification of the problems, issues, and needs of the child in collaboration with the child, their family, and their educational and healthcare teams. The school nurse provides care coordination and facilitates communication information sharing across the educational and healthcare systems. They connect families with community resources to meet existing or emerging child needs. They facilitate the implementation of an accommodation plan across transitions. And they also monitor and assess the impact of a transition on the child's health and educational outcomes. The goal is to meet the child's healthcare needs during the transition process and serves to decrease the stress associated with the transition. It also maximizes the child's health and academic success. Next slide, please. So what should you provide the school nurse with during back to school? First is a medical history of your child. Indicate if your child is immunocompromised and any concerns or symptoms your child may have. You can go through system by the school nurse, identifying any symptoms with the child's skin, eyes, ears, nose, mouth or throat, neurological system, respiratory, cardiovascular, GI or urinary system, endocrine system, musculoskeletal, any social or emotional concerns, and the reproductive system. It is very important to submit required medical and health forms in a timely manner. For the school nurse, this is an important information to help create an individualized health plan or emergency action plan and to provide necessary training and information to school staff. Tell the school nurse of any procedures that are required at school, such as tube feeding, catheterizations, oxygen, nebulizer treatments, a ventilator, or any type of pumps. Provide the school nurse with any medicines that your child may need while in school. Specify if this is an emergency or daily medication. Provide the actual medication in an appropriate labeled container from the pharmacy or healthcare provider. Provide written orders from the prescribing licensed provider detailing the name, dosage, route, frequency, diagnosis, and reason for giving the medication. There will need to be written permission from the parent or guardian to give the medication in school and any further instructions on the medication use. Collaborate with your child's healthcare provider and obtain medical orders to provide care or medication at school in a timely manner. Inform the school nurse of any transportation accommodations your child may need. Provide consent that allows for the sharing of information among healthcare providers, the family, school, and the school nurse. This allows communication and collaboration, which is necessary for the school nurse to provide services and care coordination to your child. Participate in the development of health plans by identifying child and family priorities and goals for the management of your child's condition at school. Provide any supplies and equipment that are necessary, or inform the school nurse of any needs that you may have. The school nurse can assist in the facilitation of connecting you to necessary resources. Establish a communication plan with the school and the school nurse. Provide notification of health changes or changes to the healthcare provider's plan of care. Tell the school nurse of any educational or medical concerns, and tell your school nurse of your child's strengths. School nurses should be involved in and present at all meetings where an IEP or Section 504 plan related to a student's health condition is being discussed and developed because of their ability to plan, implement, and evaluate plans. School nurses support readiness to learn, classroom participation, and academic progress. A school nurse is well positioned to support the health and academic success of your child.
Thank you, Kaitlyn and Karen, for today's informative workshop. You'll see a link to an evaluation for this workshop on our VFN Genetics Series website post. Please take a few minutes to complete it so we can make improvements and fulfill our grant requirements. We have tons of information and links to many other interesting workshops on our website, which is vermontfamilynetwork.org. You can follow us on Facebook or join our closed Facebook page if you are a parent. The name of the closed Facebook page is Vermont Families of Children with Special Healthcare Needs. You can also sign up for our monthly e-news or check out our YouTube channel. We're here to help, and getting connected with us is easy. Thanks again, everyone, and have a great day.